Here are some home remedies for toothache pain relief. Saltwater rinse. Mix half a teaspoon of salt into a glass of warm water and use it as a mouthwash. It helps reduce inflammation and cleanse the affected area. Cold compress. Apply a cold compress or ice pack wrapped in a towel to the outside of your cheek for 15 to 20 minutes. This can numb the pain and reduce swelling. Peppermint tea bags. Used peppermint tea bags can be cooled and applied to the sore area. The numbing properties of peppermint may help soothe the pain. Clove oil contains eugenol, which has natural anesthetic properties. Soak a cotton ball with clove oil and apply it to the affected area, or gently chew on a clove. Dilute 3% hydrogen peroxide with equal parts water and use it as a mouth rinse. It can help with pain and inflammation, but should not be swallowed. Crush a garlic clove to release allicin, a natural antibacterial agent, and apply it to the affected area. You can also chew on a clove for relief. Vanilla extract. The alcohol in vanilla extract can numb the pain, and its antioxidants may help. Dab a small amount on a cotton swab and apply to the affected area. Guava leaves. Fresh guava leaves have anti-inflammatory properties. Chew on fresh leaves or boil them to make a mouthwash. Onion. Onions have antimicrobial properties. Place a slice of raw onion on the painful tooth or chew it to release its natural juices. Wheatgrass juice. Use wheatgrass juice as a mouth rinse to reduce bacteria and inflammation in the mouth. Remember, these remedies can provide temporary relief, but it's essential to consult a dentist for a proper diagnosis and treatment if the pain persists or worsens. Over-the-counter pain medications. Non-prescription pain relievers like ibuprofen, also known as Advil, or acetaminophen, commonly known as Tylenol, can help reduce pain and inflammation. Always follow the recommended dosage. Always. Topical anesthetics. Over-the-counter gels and ointments containing benzocaine, such as Oragel, can numb the area temporarily. Be careful when applying it and follow package instructions. Elevate your head. Keeping your head elevated, even while sleeping, can help reduce blood pressure in the area and lessen the pain intensity. Avoid trigger foods. Stay away from very hot, cold, or sugary foods and drinks that could worsen tooth sensitivity. Acupressure. Applying pressure to certain points on your body, like the area where your thumb and index finger meet, may help release endorphins and relieve pain. Hydrogen peroxide gel. Similar to the rinse, a hydrogen peroxide gel can be used to help manage bacteria. Be sure not to swallow any and use caution. Maintain oral hygiene. Brush and floss gently to keep the area clean and prevent further irritation. Rinsing your mouth with a mild antiseptic mouthwash may also help. Tea tree oil. Dilute tea tree oil with water and use it as a rinse. Its natural antiseptic properties may help with inflammation and bacteria. Oil pulling. Swish coconut oil in your mouth for 15 to 20 minutes before spitting it out. This traditional remedy may help reduce harmful bacteria in the mouth. Desensitizing toothpaste. Using a toothpaste designed for sensitive teeth can provide relief from toothache related to sensitivity over time. If these methods do not alleviate your symptoms, or if you experience severe pain, fever, or swelling, it's important to seek professional dental care promptly. Persistent toothache may be a sign of a more serious condition, such as an infection or cavity, that requires professional treatment.